Hello friends, I am Ketki Tamankar from first year. Today I am going to talk about importance of laboratory. A laboratory is the facility that provides control conditions and in which scientific or technological research, experiments and measurement may be performed. Lab services are provided in a variety of settings: physicians' offices, clinics, hospitals and regional and national referral centers. Pathology is the science of the cause and effects of disease, especially the branch of medicine that deals with the laboratory examination of samples of body tissues for diagnostic or forensic purposes. The delivery of the specimen to the pathology laboratory initiates a complex series of events resulting in the pathologic diagnosis or interpretation. There are three types of pathology labs. First, hospital laboratory. Almost all hospitals contain a laboratory to support the clinical services offered at the hospital. The specific pathology services would include both anatomical and clinical pathology at most hospitals. Second, reference labs. Reference labs are usually private, commercial facilities that do both high volume and specially laboratory testing. Most of these tests are referred from physicians' offices, hospitals, facilities, and other patient care facilities such as nursing homes. And lastly, public health labs. Public health laboratories are typically run by state and local health departments to diagnose and protect the public from health threats such as outbreaks of infectious diseases. There are several types of members in the pathology labs. First, pathologist. Physicians with special training in the diagnosis and detection of disease. Practicing pathologist may be super specially or general pathologists. Depending on the types of cases they review on the daily basis. Next, the pathologist assistants. These individuals assist with the gross description and dissection of surgical cases and biopsies, working closely with supervising pathologists. Next is cytotechnologist. These individuals assist in screening specimens that are composed of small samples of cells rather than whole sections of tissues. Example, pap smear specimens. After screening and marketing diagnostic cells in slides, a cytotechnologist refers cases with abnormal cells to pathologists for review. Next, medical laboratory technicians. These healthcare professionals perform laboratory testing and analysis on body fluids and other specimens to help determine the presence or absence of disease. Next is phlebotomics. These healthcare professionals are trained to draw blood from a patient for clinical testing, transfusions, donations, and research. Next are PhD scientists. These professionals provide direction of clinical labs to ensure accurate and timely reporting of labs tests and serve as a resource for result interpretation to clinicians. Pathology means the study of disease and its causes and progression. If you are sick, many of the decisions about your care will be based on the pathology test. There are many tests. First is amniocentesis. Amniocentesis is a medical procedure used primarily in prenatal diagnosis of chromosomal abnormalities and fetal infections as well as for sex determination. In this procedure, a small amount of amniotic fluid which contains fetal tissues is sampled from the amniotic sac surrounding a developing fetus. Next is blood test. A blood test is a laboratory analysis performed on the blood sample that is usually extracted from a vein in the arm using the hypodermic needle or via fingerprint. Next, gastric fluid analysis. It is the medical procedure used to examine the secretions and other liquid substances occurring in the stomach. By means of a tube passed through the nose and into the stomach, gastric fluid can be obtained from the stomach. Next is kidney function test. Kidney function tests are urine or blood tests that evaluate how well your kidneys are working. Most of these tests measure glomerular filtration rate, that is GFR. GFR assesses how efficiently your kidneys clear waste from your system. Liver function test. Liver function test, also referred to as a hepatic panel, are groups of blood tests that provide information about the state of the patient's liver. These tests include prothrombin time, activated partial thromboplastin time, albumin, bilirubin, and others. Lumbar puncture test. It is the test used to diagnose certain health conditions. It's performed in your lower back in the lumbar region. During the lumbar puncture, a needle is inserted into the space between two lumbar bones to remove a sample of cerebrospinal fluid. Pregnancy test. A pregnancy test is used to determine whether a woman is pregnant. The two primary methods are testing for the human pregnancy hormone in blood or urine using a pregnancy test kit and scanning with ultrasonography. Testing blood for SHCG results in the earliest detection for pregnancy. Next is prenatal testing. Prenatal testing consists of prenatal screening and prenatal diagnosis, which are aspects of prenatal care that focus on detecting problems with the pregnancy as early as possible. Next, protein bound iodine test, also called as PBI test. Laboratory test that indirectly assesses thyroid function by measuring the concentration of iodine bound to proteins circulating the bloodstream. The next is syphilis test. Syphilis can be diagnosed by testing sample of blood. Blood test can confirm the presence of antibodies that the body produces to fight infection. The antibodies to the syphilis causing bacteria remain in your body for years, so the test can be used to determine a current or past infection. Thoracentesis is the procedure to remove fluid or air from around the lungs. A needle is put through the chest wall into the pleural space. The pleural space is the thin gap between the pleura of the lung and of the inner chest wall. The pleura is double layer of membranes that surrounds the lungs. Thyroid function test. It is the collective term for blood test used to check the function of the thyroid. TFTs may be requested if a patient is thought to suffer from hyperthyroidism or hypothyroidism, or to monitor the effectiveness of either thyroid suppression or hormone replacement therapy. Toxicology testing. It is also known as safety assessment or toxicity testing, is the process of determining the degree to which a substance of interest negatively impacts the normal biological functions of an organism, given a certain exposure duration, route of exposure, and substance concentration. Urinalysis. It is the test of our urine. It's used to detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. A urinalysis involves checking the appearance, concentration, and content of urine. Pap smear test, also called as Pap test, is a procedure to test for cervical cancer in women. A Pap smear involves collecting cells from your cervix, the lower narrow end of your uterus that's at the top of your vagina. Detecting a cervical cancer early with a Pap smear gives you a greater chance at a cure. A Pap smear can also detect changes in your cervical cells that suggest cancer may develop in the future. Detecting these abnormal cells early with a Pap smear is your first step in halting the possible development of cervical cancer. The pathology laboratory in medical science is very important. Doctors, scientists, and lab assistants working in pathology laboratories study samples from both branches to help medical professionals and doctors understand and control disease better. Clinical pathology uses urine, blood, and other body fluid type samples. The doctors working in the clinical pathology lab use these samples for laboratory testing. They are used in blood banking test, microbiology, immunology, clinical chemistry, and hematology test.